It's the world's highest health policy setting body and comes at a time when societies are in the grips of a pandemic and where deliberations will be closely scrutinized. The draft resolution, co-sponsored by the European Union and the Africa Group, calls for an intensification of cooperation and collaboration at all levels to contain, control and mitigate the COVID-19 pandemic, reiterates the importance of urgently meeting the needs of low and middle-income countries to overcome it, to provide the WHO with timely, accurate and detailed public health information, and to work collaboratively on a vaccine for all. As concerns mount about which countries might get an effective vaccine first.
In these extraordinary circumstances, we need to unleash the full power of science to deliver innovations that are scalable, usable, and benefit everyone, everywhere, at the same time.
While the issue of Taiwan's observer status to the WHO will again come under the spotlight, a region thought to have had one of the best public health responses to the outbreak, seeking to be admitted to the organization over China's objections. As the rumor mill swirls with speculation as to the future of Dr. Tedros over his initial handling of the pandemic, the first African to lead the organization.
The campaign, I think, has been an extraordinary campaign. We've not witnessed anything, I dare say, in the history of multilateralism in recent years, that we get into a global situation where all of us, all countries are supposed to rise together. Instead of rising together, there is blaming, a game, blaming who did this, who did that. It's rather like your house is on fire. Rather than put out the fire, you're searching for maybe the cinder that might have caused the fire. And in the course of that, you're likely to burn yourself.
President Cyril Ramaphosa will address the opening high-level segment along with the leaders of Germany, South Korea and the United Nations. Sherwin Brycepease, SABC News, New York.